Okay, I am Doran, and today I'll be presenting on Bedlam Asylum and how it relates to psychology today. Bedlam, a noun to describe a place or situation of chaotic uproar and where confusion prevails, or in other words, a British insane asylum in the 1600s. By looking at its history, the first asylum, Bedlam, seems to stand as a chaotic nightmare. With its less than ethical procedures and its inhumane treatment of its patient, it is no secret that it was truly a horrific institution. Individuals who were patients at Bedlam would suggest that the treatments were unbearable and harmful to their mental health, rather than what we would describe psychology as today, which is ethical and humane. Society has evolved its views on mental health, and our ethics seem to do the same, as a science evolving to help society is always a primary goal. Bedlam was an institution that did not have this evolution in mind, thus leading to its inhumane treatment of its patients. Bethlem Royal Hospital in London has evolved from the original asylum called Bedlam. Bethlem was originally established in 1247 and was renamed to Bedlam Asylum, an asylum to help treat mental and physical disabilities. In this time period, the establishment served primarily to keep these individuals away from society, but with the renaming of its institution, the clientele began to shift. This is when they started treating mentally ill individuals. This also included people with dementia, epilepsy, and other learning disabilities. Patients at this time were referred to as lunatics, which removed the humanity from the individual and maintained the stereotype that was already placed on a suffering population. This is not the only thing that removed humanity from the individual. The treatments at Bedlam were far from humane. Originally, the treatments were unclear, but soon took a turn towards something radical. Some examples of different treatments included rotational therapy, bloodletting, beatings, starvations, and even inducing blisters. Rotational therapy consists of patients being suspended in a chair and spun up to 100 times a minute. Patients would oftentimes bleed from the nose and mouth, as well as defecate during this treatment. It is said that this led to extreme cases of vertigo and vomiting, which doctors typically depicted as like a form of healing for some reason. Bloodletting by leeches includes drawing out the blood for the purpose of removing impurities within the body. It is said that Bedlam was not for the weak, as many patients would die as a result of these treatments. Mass graves have been uncovered in recent years due to the grotesque nature of these treatments. Numbers have ranged around 20,000 bodies and counting, dating back to the mid-1500s. Today, these treatments have been seen as vile and unethical, but during this time, ethics were not even a thought. Before the ethics code was established in the 1900s, mental institutions treated their patients with what was called the moral treatment. Moral treatment can be described as treating your patients in a humane and caring manner. Although this was before the ethics code, this was not practiced at the time when Bedlam was at its height. Part of the reason that the Bedlam's practices were so unethical is because during the time the knowledge on ethics was very little. Even though the knowledge was very sparse when compared to other asylums closely after, Bedlam's practices were still considered far more radical and unethical. This could be due to location, ownership, doctors, and much more. Bedlam had a riddled past between being owned by the state and the church, so it's possible that religion or other beliefs may have influenced the fact that the treatments kind of got by. It was also possible that the lead surgeon at Bedlam was suspected of having his own mental illness issues that could have resulted in malpractice. However, that was never confirmed nor denied. While there seems to be little to no evidence of ethical codes in place at Bedlam, through the grapevine, two prominent figures emerged. After hearing the rumors of horrific treatments of patients, Edward Wakefield, he's the one with this lovely mustache. He was a philanthropist at the time, and he went to visit Bedlam for himself and discovered a patient, James Norris, which is all the way on that side, who was chained to the wall and seemed to have been there for a prolonged period of time. James Norris was an American sailor who was said to have been in chains at Bedlam from anywhere between 9 to 12 years. His chains, like the rest of the patients, were only given a blanket for covering or was otherwise considered nude. And his bindings were so tight that he physically could not move from the wall. This was not uncommon for all the patients at Bedlam, as it was like a standard practice. So anyway, Wakefield brought a prominent artist who made this really famous painting, and that is also James Norris. Wakefield paired up with William Hone, him in the middle, A journalist at the Times campaigned for conditions to change for patients within Bedlam, but also throughout London as a whole. By the investigations brought on by both Wakefield and Hone, this is where the horrific rumors were proven to be true, because at the time they were just rumors. This sparked a controversy in the eyes of the public and led to many reforms and acts to be introduced. One of the biggest acts to come from the findings by Wakefield and Hone was the 1815 Act to regulate madhouses. This act introduced the idea of inspections on facilities, but as well brought to light the overall mistreatment of the patients. This also aired out any of the contradictions written in the books about the insane versus how they were actually treated. This shows to be important because it was the starting point for modern ethics and modern psychiatry. This also helps society to view these patients in a much better light and treat them more humanely. This reform led to other ethical reforms in the near future, which helped establish psychological implications. Overall, without the dark past of Bedlam, psychiatry may have taken longer in order to reach the evolution that we know it as today, which is humane and ethical. A major implication of Bedlam and the works by Wakefield and Hone may have helped society to view these people in a much better light. Rather than lunatics, in some cases, society would use these people for their entertainment value. With these findings, it also helped to kind of eradicate that. Bedlam helped to evolve ethical standards for future mental institutions, such as itself, which still stands today as Bethlehem Royal Hospital in London. These implications have impacted society and psychology, and so has Bedlam. The chaotic uproar that is Bedlam will always be remembered for a fight, or as a fight for humane treatment and ethics in mental institutions everywhere. Psychology will forever be changed by the ethical standards that have evolved over time and the importance that this institution had held. The work by Wakefield and Hone, or the work that Wakefield and Hone had done for Bedlam, not only impacted the institution itself, but psychology as a whole. Thank you. Any questions?
Well done.
Awesome.
Why? I was going to ask about rotational treatment, but you
Yes,
explained it very
I
well.
know.
So I was like, I've not heard of that one.
Yeah.
And that's horrifying.
Yes.
So I have a question. You talked a little bit about how being owned by the church, that religion might have impacted it. Could you expand a little bit on that?
What I kind of meant by that is maybe they were able to do some more grotesque things, just maybe saying, oh, but for religious factors, maybe this is, the devil compels you, whatever,
Yeah.
That's kind of what I took it as.
It kind of gives them a little bit of a pass because it's for religious reasons.
Mhm.
Where did you find information about this? I'm just curious,
Yes. So I actually looked everywhere and it was super hard to find stuff on this. And I stumbled on a YouTube video from the history place. And they talked a lot because I couldn't find anything on ethics and I was like, that's really where I want the core of my argument to be. And I was able to find it through there, within the first 10 minutes, which is great because I lose attention really fast.
interesting.
All right. Well, very well done.